We now move to the next part of this session, which is a panel discussion. So I'd like to invite Katherine Dowson, the Family Violence Project Coordinator and Strengthening Hospitals Response to Family Violence Leave from Eastern Health, to take a seat at the front, and also Louise Polednik, who is a Senior Manager, Organisational Development, Culture, Learning at Monash Health. So we've just invited them today to talk a little bit about their program and how they've gone about setting up their family violence workplace support program. So I might just start by asking Louise, if you'd like to start. There's been some EBA changes in our environment that we thought would be helpful if you could just cover them off to start with.
Thank you. Thank you. And thank you for having me. I've really enjoyed today. The speakers have been terrific, so hard act to follow. Firstly, I think the most important thing the EBA establishes, and we touched on it this morning, was this important principle that anybody could experience family violence at some point or other. And that might impact on their ability to attend work or their performance at work. And the leave allowance is in recognition that that might result in having to attend legal appointments or medical appointments. So that's what the provision's for. And the provision is 20 days pro rata. And that's for all employees except casual employees. And the casual employees can access leave without pay. So they haven't been left out entirely. The other thing the EBA does is makes provision for employees who are supporting people that are experiencing family violence. So that provision's there to take leave to help people if they're attending court, look after their children. So it's not just the individual, but those that are providing support. The other important thing for me as well was this mention about arranging for flexibility during periods of personal violence at home. So the organisation is required to make reasonable adjustments to shift patterns, hours of work, starting times, and even, we touched on in the previous presentation, changing phone numbers and email addresses if necessary for the period of the threat. And that can be renegotiated should the threat subside. The EBA also sets the expectations that the employer will point out where people can go for professional support. So it may be an employee assistance programme or other local help. And the legal definition of in the EBA refers to the 2008 Family Violence Protection Act. And we've spoken a lot about physical abuse and violence, but that also encompasses any behaviour that's intended to threaten or control, and that includes taking away economic independence, for example. So that again is something that I was mindful that I hadn't appreciated, that this controlling of finances still has a detrimental effect on the woman. And the definition of family within the EBA is also necessary that we understand that that encompasses all genders and all family configurations. So a very useful document, I think.
Great. Thanks, Louise. That's a great summary. Just to give you another couple of minutes to just cover off what Monash are doing to develop their workforce support program.
Okay. Although Monash was looking at steps that it put in place to support our colleagues who might be experiencing abuse at home, I think it's fair to say that the EBA was a real catalyst for us to take urgent action. We've got something like 17,000 employees at Monash, so massive chance that there are some of them that are experiencing family violence as we speak, not to mention that we've probably got a fair share of perpetrators too. Before I tell you about what we're doing, which is never going to be enough, around the time that I joined this task force to address workplace and family violence, we got a complaint to our HR hotline from a nurse who, having decided to leave an abusive relationship with 2 young children, she wasn't given the support that she should have had. And as so often happens when people decide to leave their partners, the threat escalates. And with that was the imperative for this woman to be more financially independent, and we didn't do what we should have done. She explained how greater flexibility with her shifts and not having to produce evidence and provide endless lengthy explanations to different people could have made a difference, which was one of the most difficult times in her lives and her children's lives. So that sort of illustrated to me that we had a lot of work to do. What we did most immediately was think about what the EBA was saying, and we had very little difficulty persuading the chief executive to extend the parts of the EBA to the whole of the workforce. So that was fantastic. And we had the usual lengthy discussions about what our policy statement should look like, and went round the houses and thought about motherhood and apple pie statements, etc., etc. And in the end, we went for the KISS principle and kept it simple, so that we put how people could access family violence leave with all the other leave stuff, which made perfect sense. So it's there very clearly how people can access it, what to do. We had a discussion based on the work that the women had done, really. You really have been a pioneer and a guiding light for us as well, about how we allocate any family violence leave that's taken. So it was really important that confidentiality was maintained inside and outside the organisation. So we've got a secret ninja code that allows us to count the number of hours rather than the people, that nobody knows. There's 2 or 3 people in payroll know it, and it doesn't show up on pay slips. So nobody has to explain why they're taking leave to a difficult partner at home as well. And it can be accessed through a manager, a colleague. Any of our HR team will also help people to access it. And it can be taken as sick leave and then converted afterwards, so that there isn't this stigma attached to requesting family violence leave. And the focus of our education has been to make sure our people and culture team that support managers know what to do and what to say. So they've been through a 2-hour programme. There are around 30 or 30 plus business partners that went through a 2-hour programme that not only included information about the policy and procedures, but went through the sensitive inquiry process. I think as HR professionals, we're very much asking people to record information, focus on behaviours, and it's very different when there may be a suspicion that somebody's experiencing family violence. So the very clear message is, if drops in performance standards or attendances is uncharacteristic, you need to be asking why rather than what. So that's the very clear message that we've given to our people and culture people, who are then passing that message on to their employees and their managers. We're in the fortunate position that we own our IP on our leadership programmes. So while we're waiting for funding for all this fantastic training and education we're going to do, what we have done is incorporated it into our everyday leadership programmes. We have a captive audience of leaders and managers who are required to do some sort of leadership education, and one of our programmes is called Hard to Have Conversations. In all those programmes now, there is a section about sensitive inquiry in relation to potential for family violence. So that's what we're doing in the training space for now. And just to finish off, I'd just like to read you this little bit of feedback we got in contrast to the feedback that I mentioned at the beginning. This is from a woman that took some time off and recorded it as family violence leave. I didn't take much leave. I just needed a day for court and a couple of hours each time to attend appointments. The EAP counsellor, she was fantastic, really supportive. I don't think I could have done it without her. When I'd used up my 3 sessions, they arranged it so I could have some more to get through the court until it was all finished. HR were really helpful and understanding. And in terms of my son, he's much happier, more settled, enjoying things since the access has stopped. I took him to a counsellor.
Thanks, Louise. It's just worth noting that in the latest release of the Strengthening Hospitals Toolkit, there is some of the EBA information and workplace support information included, but stage 4 will be a much greater development of that going forward. So hopefully we'll be working with the hospitals involved to develop that significantly over the next 12 months. So I'll hand over now to Katherine, and I thought maybe you could just give us an overview of how your program's working at Eastern Health and how you've put an effective program in place.
Thank you. So our experience and journey has not been dissimilar to Monash, and we've been working on this piece of work as part of the project for over 12 months now. I guess I'll talk about what maybe we've done a little bit differently, and hopefully it's some really practical information that you can take away today. Within Eastern Health, our workforce is our community. Something like 87% of our employees come from our catchment areas. So I'm not sure how that equates to everybody else, but what we understand that what's happening in our community is happening in our workforce. So the very first thing that we did is we looked at the wellbeing of our staff, and each year we conduct a wellbeing survey in addition to the People Matters survey, so separate to that. And last year around November, we asked the question, very simple question, people will laugh about this, there was no rocket science behind it. Have you experienced family violence in the past 12 months? So our data back from our staff said that 7% had experienced family violence in the past 12 months, and over 10% either experienced family violence in the past 12 months or did not wish to comment. So you can take from that what you like. It matches up with the data that Kelsey presented earlier today. So it's not surprising for us that work in this space, but it was alarming for our executive team. And that data really has proved the foundation piece of work that we have then built upon all of these processes that Monash have talked about as well. So that's one of the key things that we've done that's helped to be successful at Eastern Health. The other 2 things that we've done is we have worked very closely with a survivor advocate. Our survivor advocate, who's here today, Nicole, sits within our Family Violence Reference Group. Our Family Violence Reference Group is made up of every program director from within Eastern Health and most of our key community support agencies. We meet every month to tackle this issue. Where Nicole has been instrumental is she has provided that personal voice, that personal experience to people, like I was saying before, that don't work every day in this space, to people who still sit and think, this won't happen to me, this is not happening to my neighbour, this happens to this sort of person. She challenges every concept in that regard. She put a name and a face and words to all of the data that we flash around. And that has been key to having that executive buy-in and the cultural change that we've needed at Eastern Health. The final thing that we did is we have very strong and true partnerships with our community providers. So within the Eastern region, we have EDVOS, the Eastern Domestic Violence Outreach Service. Our partnership with EDVOS and meeting with EDVOS at a minimum of once a month has meant that for our staff, we have a partnership with EDVOS where they provide a specialist family violence advocate that sits within our HR service at Eastern Health. That person is available only for our staff. And our staff can meet with that person either on-site, off-site, at EDVOS locations to talk about what they're experiencing from family violence and be linked into a specialist family violence agency. So they're the top 3 things. There's lots of things that we've been doing, but they're the top 3 things that have worked for us. And I know it's overwhelming, but hopefully that's a little bit of a help today.
Great, thanks, Katherine. We will take questions briefly at the end. I was just going to touch on a couple of additional things about what we're doing at the Women's to add to what's been said. I think a couple of things around people and culture involvement in any program like this is critical around the leadership, understanding the EBA, how it's interpreted, and also putting things in place to make sure it's effectively executed. Some of the things that we found very successful have been visual prompts, posters, things like that, letting staff know about the availability of a program. And we have an intranet site for staff that goes through the policy and procedure and explains how things will happen. And I think that's helped people just understand around the privacy and the confidentiality, particularly about what gets shown on pay slips and things like that. We've also been invested a significant amount of time for all our managers undertaking 4 hours training, so that's clinical and non-clinical managers, so that if staff disclose or there's any issues, managers know how to, respond appropriately. And we're also, all staff undertake training as well around understanding family violence more broadly. So there's sort of the high-level things that we found to be very successful to date. I did want to touch a little bit on the self-care element for staff as well. So we're talking about here not only about our staff who might be experiencing violence, but also staff that are dealing with it day to day. So I thought I'd just ask Jenny Chapman very quickly to touch on what we are doing. It's just coming now, Jenny, what we're doing in our for our staff, our clinical staff.
And as we keep talking about, we've learnt a lot along this way. We've been going for quite a number of years, but what has become evident is that the self-care and the practitioner-centred care that Elsie made mention of before, particularly through the WITH study that was funded through ANROSA, and also the feedback we're getting from staff doing training, because we've been doing training for some time now. So we're looking at creative ways of supporting staff who are working in this complex area day to day. So our rollout area has primarily been our emergency department. So we offer support sessions, and it's being present and being available to support staff, to workshop some of these issues, to talk about it. It's not formal supervision for those professions who do receive supervision, but it is providing that support and debriefing. We do informal ad hoc education sessions as well as formal education sessions, and we do encourage people to access the supports we're talking about, like EAP and other areas for support. But it really is a focus going forward, and we're looking at testing a model of clinical champions responding to both these sorts of issues around practitioners experiencing violence, but also practitioners working in responding to women with violence. So we're looking at testing that as around a sustainable model, and hopefully assisting staff to continue to do this really important work.
Great, thanks, Jenny. So we haven't got a lot of time, so we thought maybe just open it up if anyone has any questions for either Katherine or Louise before we move on. Any questions at all? No? Yep. Oh, Kelsey, of course.
Yeah, I think it sounds like everybody's doing great work. I think if people are thinking of putting a question into a wellbeing one that's a labelling question like have you been a family violence or a domestic violence victim is going to get a lower prevalence than if you actually ask about a behaviour or whether they're afraid of their partner. So I suppose it doesn't matter because the mechanism worked for you, that enough people disclose that way to make it a serious concern. I just want to raise another issue which Pia arose, and it comes from the fact that I've just been looking at a lot of work about police trying to work out who the primary aggressor is or who the perpetrator is. And I just think the questions you raised, Pia, about how you confirm someone's a perpetrator, I just don't think it's within a workplace scope that you could do that. And I think that we need to be very careful about how we go about that, even though we might be very feminist and very women-centred, we need to be extraordinarily careful in that space. Anyway, that's my 2 comments.
Any other questions or comments before we...
Can I just talk to that quickly? Yeah. Just in relation to the survey process, within our project managers group within the 16 original funded hospitals, we've been looking at, we know that not every health service does wellbeing surveys, and everybody has a different way that they keep a gauge on their staff. But what we all do is the People Matter survey. So we've been putting forth the idea and the concept that perhaps we could look at some questions around family violence as part of that People Matters survey. And then we would have a benchmark across our health service in relation to this issue. And thank goodness Kelsey's given me the thumbs up.
Thanks, Katherine. I think one of the challenges of today is there's a lot of work that's going on outside of Monash Eastern and the Women's that's very valuable to share as a group, but obviously we have limited time today. So hopefully through the Strengthening Hospitals program in stage 4, we'll have a much greater opportunity for discussion and exploration around this issue. So I'll